everyone. Thank you for watching Atlanta & Company. I'm Kara Kinnear in for Christine Pilara. Well, Dr. Whiteman thought it would be beneficial to bring one of his tummy tuck patients on to speak about the procedure from a personal perspective. He is here with Gwen Torrance, a former Olympic athlete. Gwen took home the gold, bronze, and silver medals for the USA in track and field over a 12-year period from 1985 to 1997. Thank you both for being here today, Dr. Whiteman, Gwen.
Yes.
It's such a privilege to have you both here, and we're going to talk about tummy tucks. So Dr. Whiteman, first explain to us what a tummy tuck is, and I know that you have really invented a special procedure, so talk to that a little bit.
So a tummy tuck itself involves removal of skin from the belly button down to the pubic area.
Okay.
It involves some liposuction, and it involves some muscle correction, or the putting together of tissue that was separated, or muscles that were separated during pregnancy. And what I've been working on and was able to present to actually a group of about 1,500 plastic surgeons in Montreal is a technique that actually allows waist narrowing or waist modification as well. It's exciting, and I'm very pleased with the results, and I've actually gotten several phone calls and correspondence from around the world regarding the procedure.
Well, Dr. Whiteman, we were just looking at some before and after pictures, and it's amazing how you can take the waist and really contour it in. And I know that's one thing, as you were just saying, that you are actually teaching other physicians. If you are looking for a doctor to do a plastic surgery procedure, you want a doctor that's teaching other doctors how to do that, right?
Sure. But any doctor who's board certified by the American Board of Plastic Surgery is a qualified doctor to do a tummy tuck. I think when you are looking for a physician or a surgeon, make sure that the relationship is good, that you hit it off, and that the surgeon is open to talk about not only the procedures, but risk and benefit.
Mm-hmm. Gwen, speaking of that, having a good relationship with the doctor, you know, how was it choosing Dr. Whiteman for you?
Well, for me, it started with, I had a client that came in and she had her boobs done. And her boobs were gorgeous.
Right.
You couldn't see the scar, and they were just beautiful. And I asked her if I could touch them. And she allowed me to, they jiggled, they were beautiful. So I was like, I'm going to give him a call, and I want to go on his site to see what he's doing. And because that was what I was interested in, was the tummy tuck. I looked to see how his scars looked, what it looked like before and after, and I loved what I was seeing. I loved their navel position, and so I decided to give him a call. And I called him in 2012, and I just chickened out. I wasn't ready, and I just didn't do it. And here I am years later. I'm like, my birthday is coming up. I turned 50, and no matter what I do to work out, the stretch marks aren't going anywhere. And I wanted the stretch marks to be removed, and I really liked his bedside manners when I went in 2012. He was so nice, he was so funny, and I was so comfortable with him. I thought it was my brother from another mother. And I just made up my mind it was time, and then I had another client that wanted some work done, and I actually sent her to him, and she loved him, and I was like, I'm doing it. I like what he did for her, and I said, I'm going to do it. And I actually made an appointment before I made my consultation to have it done.
Nice. Well, and I think that's so important too. You liked what you saw aesthetically on your friends and on his website, but then when you met Dr. Whiteman, there was a really good rapport, and you felt comfortable. Because I think that's one of the most important things when you're doing something that's life-changing, essentially. You need to feel comfortable and like somebody's going to be there with you through the whole thing. So that's beautiful.
You have to trust that person, because you're literally putting your life in their hand before and after. And you literally have to trust this person. And I trust him with my life. I said my prayer before I closed my eyes. And
okay, well, our viewers are very interested, too, about the tummy tuck procedure, so they had some questions for you that we want to show on the graphic. So I think we're going to show those right now. Okay, so the first one, what were some of your biggest concerns about the procedure, and once again, why did you choose Dr. Whiteman, which you already kind of covered, but what were some of your fears going in that he kind of squashed and made you feel at ease?
I really didn't have fears. My main concern was waking up. I wasn't concerned about the pain, because I'm sure if you cut me, I'm going to hurt. If you pulling stuff together, I'm going to hurt. So I knew I would be in pain. I wasn't afraid of that. My biggest concern was waking up. I have kids, I have a grandchild, I have a husband, so I wanted to wake up. But I knew if he told me he was going to rid the stretch marks, I believed that he was going to rid them.
Right, right. And that really speaks to your expertise, Dr. Whiteman. Now, another question was, how do you select the right doctor for doing a tummy tuck, and what credentials should they have? I know you said board certification, but
Sure.
kind of go into that a little.
Unfortunately, we've kind of moved into this buyer beware market when it comes to plastic surgery and cosmetic surgery procedures. There is some crossover, I would admit that. But when you're doing a tummy tuck, I think the only person that should be doing a tummy tuck is somebody who is board certified by the American Board of Medical Specialties in plastic surgery.
Okay.
That's the way to do it.
Okay, and that's important. It sounds like common sense to think that, but you really need to ask your physician, are they board certified? Where did they study? You know, because all of those things can help you make a better informed decision.
Most importantly, you should also ask them, what was the specialty in which they received their residency?
Okay.
Okay, because there are people out there who are not trained in plastic surgery who are performing those procedures.
Right, very important. And Dr. Whiteman, are all tummy tucks done in the hospital?
So, I would have your tummy tuck done in a state-certified facility.
Okay.
There are hospital outpatient centers, and it is an outpatient procedure, in and out on the same day. There are many board-certified plastic surgeons who may have their own state-certified facility. That's fine. But the reality is they should not be done in kind of a small clinic-style environment. I think you're going to get the results that you would expect.
Right, right. Gwen, another viewer question for you was, what was your recovery like? Dr. Whiteman just spoke to it a little bit, but what was it like when you did wake up?
Well, I won't lie, you do need someone there to help you because it is surgery.
Right.
And fortunate for me, my husband was there for me to help me get up. The doctor told me to make sure I walk around, go use the bathroom.
Right.
And I did that, and it was a recovery, and I am still recovering. You are sore, but it's not life-ending. And for me, it took me I went back to work through my third week. I went back to work my third week.
That's great.
Yes.
Third week, that's great.
I try and tell people, plan on having at least 2 weeks of your own time.
Right.
If you're somebody who has a desk job or can work by phone, I think you could be working in the second week. But for instance, a hairstylist, which is what Gwen is doing, that's a physical job. You're on your feet all day. So that's a full 2 weeks recovery. But at 2 weeks, we want you walking, 3 weeks more low-impact exercise, and 4 weeks full exercise.
Okay, great.
Yes.
We so enjoyed having both of you. Dr. Whiteman, thank you so much. Gwen, it's a pleasure. You look fantastic.
Thank you. I feel
an
fantastic.
Olympic gold medalist, people. Got a tummy tuck. You look beautiful.
Thank you.
So much. We appreciate having you both. If you would like to contact Southern Plastic Surgery, you can call 770-622-9100 or log on to southernplasticsurgery.com. And the segment was paid for by Southern Plastic Surgery. But with a helping heart and expert culinary skill, our next guest shows us how his love of cooking is benefiting the greater Atlanta community. Details when we return.